Welcome to the Africa Dialogues on COVID-19. Basically, the question is, what's the impact of COVID-19 on mental health and well-being, and also the silver lining, the opportunities that exist for all of us as we look into the future.
The world has been on high alert and high anxiety for the last 6 months at the very least. And that has had dramatic impact in lives, livelihoods, quality of relationships. And with COVID not yet being put to bed, this is only expected to continue.
Vulnerability and acceptance that I am vulnerable, that it's okay to be stressed, that it's okay for me to feel anxious or confused, and it's okay to reach out to another. And that's the space we must reach out to our people, to our young ones and not so young ones, to families, to couples.
As Africans, we have a culture that enforces the sense of community, and that can be seen right now everywhere, right? We've seen people do mutual aid, and that's one of my favorite things about this crisis. It's been young people or people stepping up to take care of the more vulnerable members of their society.
Something we all have in common universally is if we're going through a hard time, we just want to talk to somebody about it. It just helps us feel better. And so that's a natural propensity. So as a caretaker or as a help giver, that's going to naturally happen. You just have to make space for it.
Leaders should understand that stress and anxiety during moments like this is very different from stress and anxiety that builds up over time. And so I think in this moment, we are really just being challenged as organizations to change the way we work and to be open to experimentation and to that evolutionary process.
Everybody is struggling. Everybody is feeling this anxiety. That reaching out and having that conversation and creating the space, being the thread that becomes that rope, is something that we all can be. Let's find a way to bring Ubuntu to life. Thank you. Please have a good day. Stay safe. Stay mentally healthy.